Welcome, welcome, welcome to Monica May's One Take Live. And I'd like you to please help us spread the word. You can tap like and click the share button to invite family, friends, and followers to be a part of our conversation tonight. One Take Live streams live to Facebook, YouTube, and we're also on Spotify. I'm Monica May. April is National Minority Health Month, and we can thank Brother Booker T. Washington, who started it back in 1915. It started out as a week-long observation, and of course, it has evolved. And today, we use it as a time to access health care and take other actions to improve our well-being. And that's for the well-being of everybody, our families, community, everyone. This year, the theme is Be the Source for Better Health, improving health outcomes through our cultures, communities, and connections. And one of those connections in our community is an organization. It's a nonprofit. It's called Center for Change. And on their behalf, Shayla Moore, who is a board member, she's also a family nurse practitioner, a UCF undergrad. Go Knights. She began her nursing career in 2011 after completing her master's at Advent Health University. And I am so excited to be able to talk with her about all the wonderful things that Center for Change is doing in our community and how it ties into National Minority Health Month. So how are you doing, my dear?
I am well, Miss Monica May. I'm well. How are you?
I'm fine. Tell us about yourself and your role there at Center for Change. I want to know all of those initials that go behind your name. What do all of those mean, my dear?
Well, I am a advanced practice registered nurse. That's what the APRN stands for, with a focus in family medicine. But currently, I specialize in gastroenterology and hepatology. And I recently joined Center for Change as a board member, basically just offering my expertise and my knowledge and experience, from my background, and helping to develop different policies and procedures and provide my voting opportunities to just make sure that things are running smoothly with the organization.
When we talk about Center for Change, can you share, doesn't have to be verbatim, but the mission and when it was started?
Okay, yeah. So the mission of Center for Change is to provide health education and services to individuals and families in need due to economic, social, and health disparities. The organization was started back in 2005 as a reaction and memorial to the executive director, Miss Peggy Burgess, her sister, Miss Renee Melody Fulton. She was diagnosed she was diagnosed with colorectal cancer, and she was about 45. And it was a long time of suffering for her. And so Miss Peggy, created this organization as a memory to her and to help, educate and empower others to take charge of their health.
And it has, you talk about evolved. I'm telling you, I'm really telling you, if there is ever a cause in the community, Center for Change is right there providing services. So I just give a big shout out to Peggy, her team, everyone who has grown up in that organization and who is making it flourish. So what are some of the services that are provided by Center for Change?
As you said, yeah, it has grown a lot. I used to volunteer when, she first started it up, and I've just seen it grow, in an amazing way. Currently they have what's called a chronic disease self-management program where they educate people who have chronic conditions such as diabetes, cardiovascular disease, things of that nature. It's a 6-week workshop and just getting evidence-based learning tools on how to effectively manage, that disease. Just for myself, I know working in the hospital setting, I have seen firsthand the readmissions with people coming in with these different chronic diseases and not even knowing what medications they're on, what they're for, things of that nature. So this is a good program to help them to be educated so that they can take charge of their own health.
Mhm.
Additionally, there's nutrition classes that we offer, just learning benefits of healthy eating and how to make nutritious meals. Screenings for colorectal cancer. We do the iFit testing, which is where you send off a sample of your stool. And based on the results, we notify, if it's normal or abnormal. We can't really go into detail, but we do
Mhm.
refer you to reach out to your primary care physician, regarding those results.
Mhm.
Additionally, we do screenings such as A1Cs, blood pressure screenings, as well as PSA screenings for prostate cancer.
Mhm.
There's also the Healthy Heart Blood Pressure Program, which is a new program that was introduced this summer, coming out this summer, to actually help people to, be more cognizant of their blood pressure monitoring. So
Mhm.
the participants are given a free blood pressure monitor so they can monitor their blood pressures at home.
Mhm.
And there's more. There's also Walk for Wellbeing.
Uh-huh.
So coming soon, where you'll get a pedometer to track your steps, to just encourage you to just get more out, more active, and get
Mhm.
those steps in, more above what you normally do, basically.
Right, right, right.
And then also there's a stress reduction group, which is this is more taking the holistic approach to developing programs to promote and empower individuals to make positive changes in their lives. I think we all can attest to
Mhm.
just how stressful life can be. I think one of
Mhm.
the things that I hear people say all the time is just life be lifing, right?
Yeah, that is a new phrase everybody's using. I've used it a time or two myself.
Yes, yes. And so, the woes of life, or should we say adulting, they just come,
Mhm.
every day. And I think it's important to have healthy ways to cope with that kind of stress, because if you can't have your mental health together, then it's going to be
Mhm.
hard to focus on that physical health as well. So,
Absolutely. This is a great menu for good health. And again, Shayla Moore is a she is one of the board members for Center for Change, and she
mhm.
has a whole bunch of letters behind her young-looking face, but she's been in the game a long, long, long time, and
Yes.
so some of
Yeah.
what she's sharing are just some, things that we need to be doing for
Mhm.
ourselves if we
Mhm.
wanna stay in good health, and that's
Yes.
what
Yes.
Center for Change is all about, keeping our community in good health. It is located on Silver Star in the Pine Hills area, but they service 3 counties. What are the
Mhm.
counties?
We service Orange, Osceola, and Seminole counties.
Mhm,
We are, fortunate to be a grant-funded agency, so we can provide those services free of cost to adults ages 18 years and older. And our vision is to become that premier agency in the state of Florida, addressing those disparities among, the minority groups such as African Americans, Hispanic American, and Caribbean American communities. But the
mhm.
services are available to all.
We're talking about National Minority Health Month, and it
Mhm,
is the month of April. Started
mhm.
out in 1915, if you can believe it, and
Yeah.
we have been going strong ever since. There are certain health fairs in our community, and that's a one and done, a one pop, but Center for Change provides services year-round for, families in our community, and
Mhm.
it's about keeping people healthy. She just listed a bevy of yeah, it's a whole menu for good health, I'll say, and which is good. And, some of the activities that you all have participated in, can you tell us where we can find you out and about in the streets?
So recently, like you said, because April is the National Minority Health Month, we partnered with the Sunshine Health Welcome Center, and we provided free blood pressure checks to the participants, and they received free blood pressure monitors. Um, we also facilitate health presentations within the community on diabetes, cardiovascular disease, colon and prostate cancer, as well as a number of other health topics that are focused on that community.
Mhm. Is there a fee for the services that you all provide?
Nope, like I said, because we're grant funded, it is totally free. You just
I
have to
love
have that account, that take that initiative, to want to learn about your
Mhm.
health and be able to
Mhm.
manage it. So.
When I spoke with the nutritionist earlier today, we're doing a topic coming up on getting girls ahead of the curve when they go off to school. And one of the
Mhm.
things that we're talking about is how the freshman 15 is now the freshman 20. And in some instances, why you turn your head, why you turn your head, in some instances, it's now even the freshman 30. So it's
Yeah.
like, oh, we've almost doubled in that freshman year.
Mhm.
And a large part of the notes that I've been reading and the research I've been just perusing is all about stress and lack of movement and not knowing what to eat. Now, our food is the root cause of a lot of things. So,
Mhm.
the nutrition classes that you offer, can we go into them just a little bit more? Because many of us live in food deserts, meaning there's no real food or grocery store available to us, but we do have um, hmm, lots of fast food chains. We do
Mhm.
have
Mhm.
dollar stores that offer frozen food items, non-nutritional. So
Of course,
how
of
do you
course.
get better food practices into people who are just not even exposed to good eating places?
I think, first, definitely attending, the nutrition courses that are held. Some of them are virtual and some are in person, but I think it's important to just to know what foods are healthy.
Mhm.
Like you said, in a lot of the should we say lower or socioeconomic areas, like you said, you have the fast food and
Mhm.
more of the dollar stores, and so we know uh, quick fast is not the healthiest.
Right.
But there are other options. You can maybe still go to McDonald's and instead of getting the fries, get fruit, get
Mhm.
a yogurt or something like
Yeah.
that. So just
Or
knowing what.
salad.
Right, or
Mhm.
salad.
Yeah.
Exactly,
Mhm.
exactly. So you just have to know what foods are best to eat.
One of the things that the nutritionist pointed out that I wanted to share tonight is that our babies are coming back with old people diseases, is how she put it.
Mm,
So
mm,
she talked about diabetes
mm,
and yeah, and heart situations, and she even talked about athletes who are bulking up to play, but then
mhm.
suppose they don't get chosen to go into the NFL. They've got all this excess weight, and if they don't maintain it, it becomes
Mhm,
fat. So
mhm.
what are we doing? We're welcoming back our degreed young people with lots of health issues.
I think, and you are so right. Oh my goodness, the fact that you said the babies are getting old people diseases. Like I even
Mhm.
think about myself. I have a young one, and my life is pretty busy. And a lot of times, we know the toddlers, they love the chicken nuggets and the French fries. That's that's usually
Yeah.
their go to. But we as parents, we have to set that example for the younger ones.
Yeah.
Take the time, meal prep, you know,
Mhm.
choose healthier options, introduce more fruits, more vegetables into their daily diets.
Mhm. My husband is a chef, and he does a cooking class for the Paramore Kids Zone, and
Mhm.
every week he comes back and he says, "You know, the adults always tell me what the kids won't eat." And he said, "And I bring those things there, and, it's all in preparation and the
Yes.
education that you give
Yes.
them." He's
Yes.
got those kids eating more vegetables than they've ever heard of in their
Wow.
lives, and they're enjoying them. He's giving them an opportunity to feel them,
Mhm.
to, smell them, taste them,
Mhm.
that
Mhm.
that whole thing, and I think exposure is very big, so
Yes,
I
yes.
know that with Center for Change, that is what you all are doing, exposing
Yes.
people. Chronic
Yes.
diseases and chronic pain, self-management, those are things that we have to learn to manage,
Mhm.
and only way you can do that is through education. So, when
Yes.
we say that we have the chronic disease workshops, are those ever going? Are they evergreen is what I would call it, meaning are they in place all the time, or are there certain times that they start and stop?
Yes, so it's ever rolling. It's a 6 week course, and usually we post whenever the next cycle will start. But it's a 6 week program. Once you start.
Mhm. Now, did you say post? May I know where to find this information, please?
So we have a social media platform on Facebook as well as Instagram.
Mhm.
On Facebook, it will be Florida Center for Change, as well as Instagram, it's Florida FL Center for Change.
Okay. And I'm writing that down so I can refer to that as well. When we talk about our health, what is the average age of people who use the services for Center for Change?
The average age, well, it ranges.
Mhm. Would you say mostly seniors, mostly senior citizens?
Yeah, we do see a lot of the senior citizens. I think because of maybe the just the timing. Like I said, us younger, less seasoned people, we're working every day, and so our time is limited sometimes. But we still have to find that time to fit in. Taking charge of our health. So.
Mhm. One thing that I do know when we're out and about and we're doing these health fairs and we do, like, say, a screening for prostate cancer, and
Hmm.
while you may do the digital rectal, while you may do the PSA screening, how do these men, if they mm, are showing that there is cause for doctor's care, how do they get in with a doctor if they don't have insurance?
So we actually have, it's like a house of resources. We are able
Ah, good.
to direct them to the community health centers that are available in the community, Shepherd's Hope, places like that that service people who don't have insurance or are underinsured.
Mhm. So, and again, I go back to all of these interviews and these wonderful people that I'm meeting. You know what I would love to see happen? I would love, and I'm going to mention this to Miss Peggy, and this just popped in my mind.
Hmm.
There is an interview that I did with a gentleman. He's from our community, and he and two other African American men went into business to do just healthcare, just
Hmm.
healthcare insurance, and they help you navigate the marketplace. They will help you to get in with the big boys.
Hmm.
And so I just think I would love to see an evening where that was a part of one of the workshops that Center for Change may provide, because a lot of times we're doing stuff with people who can get insurance. They just don't know that they are
Hmm.
there's ways and that they're eligible, you
And
know?
I think that's important, especially for the men. We know how stubborn they can be,
Yeah.
um,
Yeah.
with
Yeah.
with
Boy, do
with
I know.
with
Okay.
with taking care of themselves. So that's amazing. Yeah.
I'm going to suggest that one. So again, the menu for good health that Center for Change offers includes chronic disease, which would be diabetes. They also
Mhm.
offer chronic pain self-management workshops. Those are ongoing. They have
Mhm.
nutrition classes where you can learn the benefits of healthy eating and how to make healthy and nutritious meals. I'm going to put a point right there and say this. One of the things that our young people are not learning how to do is how to have what I call safer snacks. And
Mm.
that includes, say,
Mhm.
instead of going for a bag of chips, say
Mhm.
you use a couple of, say, maybe even pita bread, and you
Mhm.
dip it in
Mhm.
some hummus and do
Mhm.
that. There are other things that we need to get our young people interested in. Eat a
Yeah.
carrot and put some
Yeah.
hummus on it or some
Yeah.
peanut butter on it.
Mhm.
Things that you can have in your dormitory that don't require refrigeration, that
Mhm.
you can
Mhm.
have. I'm sure they have all have refrigerators at this point, but small things. And I
Yes.
think small
Yes.
changes can go a long way, can go a really long way. And you
And it's
have older
healthy.
people. Mhm.
Mhm.
And you mentioned earlier, Shayla, meal prepping. That's important too.
Yes,
What do
because
you think of that?
if you
Yeah.
don't prepare, you'll be more apt to go to the fast food because you don't have anything, ready available. Like you
Mhm.
said, packing a snack, as they're walking to class, they have little Ziploc bags of nuts or,
Yeah.
some fruit or things like that. It's very important to prep.
Mhm. That walk for well-being, I can't wait for that, because you're gonna find that people may only be able to make it a block that first time.
Mhm. Mhm.
you
Mhm.
know, a quarter of a mile that first
Mhm.
time. And if they don't give up, just look 3 months from
Further,
now,
a
the
little further.
distance they can
Mhm.
go. And the
Mhm.
importance of keeping your body moving, you know that better than anyone else in the practice that you're in. But let's just share with listeners, why is it important to exercise? Why is movement important?
And as we talk about these chronic diseases, they all come with, how can we minimize risk? You have modifiable risk and you have non-modifiable risk. We know that the non-modifiable risks are, let's say, genetics, things that we
Yeah.
are predisposed to. But the modifiable risk would be like the way we eat and that physical activity. I'm
Mhm.
telling you, just from the research, you can look it up to see that, you know, to minimize your risk for all of these different conditions, physical activity is always there. It's always
Mhm.
there. Keeping your body moving, it helps to keep the blood flowing through your body. And we know that every single organ in your body needs good blood flow to work
Mhm.
properly.
Mhm.
So, you got to get out there and get moving.
And once you're moving, hydration is really, really, really important. We
Oh,
live in
yes.
Florida.
Oh,
It's
yes.
hot.
Yes.
It's hot. And we
Yes.
can't stop walking because it's hot out.
And you'd be surprised at how much people take drinking water for granted. Uh, you'll notice sometimes you have a headache, and when you think back and say, "How much water did I drink today?" If
Wow.
you know, water does wonders to the body. Wonders to the body.
I always say, have a bottle with you. You know,
Yes.
you can put it in
Yes.
those fancy Stanley cups that everybody is
Mhm.
using.
Mhm.
Whatever the case may be, you gotta do something
Yes, but yeah,
that,
those symptoms of dehydration or like headache and just feeling
um
tired, and sometimes your heart can be elevated because you're dehydrated. So
hmm.
water is key. Water is key.
What made you wanna go into nursing? When did you make that decision?
Well, nursing was actually my second
What?
degree. I didn't list it, but my first degree was in health administration. And that's actually when I met Miss Peggy with the Center for
Mm.
Change. I had interned with her. But then I worked for about 5 years, and just there was just a pull that I needed to be doing more of
Mm.
that direct patient interaction. And so that's when I decided to go back to school. Everyone thought I was crazy because I quit my job at the time, moved back
Oh, I
into
love it.
student housing for that nursing program at UCF. But when I became a nurse, like I just felt like this is my purpose. This is what I'm supposed to be doing. I guess some people say nursing is a calling, and I think any job where you're servicing others, and it comes with a sacrifice, to yourself, to your time, but you get so fulfilled when you see the difference that you make in somebody else's life. So
Listen, Shayla, you are a walking example for
oh,
young women. Yes, you are for young women. I hear people say that I want to go into nursing. I don't think they realize all that it entails. All that it
a lot.
entails.
It's a
And there's
lot.
so many specialties that you can go into.
Oh yes, yes, I've done med surge, PCU, which is progressive care. I've done intensive care. I've done dialysis. I've done surgery or post anesthesia care. And
Mm.
then that's when I decided to, go on and get my master's for nurse practitioner. But yeah, there's so many avenues within nursing. If you get bored, not that I got bored, I love
Mhm.
learning different things, but there's so many opportunities in nursing. It's endless. Endless.
I love that, and that you would come and still sit on a board for a place that you interned with at one point. So that means that you saw the progression and you see
Mhm.
the potential for
Mhm.
all that Center for Change can provide
Oh,
to our
yeah.
community. Look it up, Florida Center for Change.org, and you will see all the services. You will see when the team is out and about. You will see when you're invited inside. You can partner with them and invite them in. they'll do a workshop for you. They'd be
Mhm.
more than happy to do a workshop for you. Again, the menu for good health prescribed by Center for Health includes chronic disease, diabetes, chronic pain, self-management. Those are workshops, ongoing workshops, nutrition classes as well, where they're teaching you the benefits of healthy eating and how to make healthy and nutritious snacks. Why do we do that? Because y'all, our propensity for obesity is increasing, and
Mhm.
obesity is hitting our kids younger and younger and younger. We talked about that freshman 15, now almost up to about freshman 30. I've seen it happen before my very eyes. And a lot of times, kids, I know when I sent my daughter off, I couldn't afford that meal plan. So
Mhm.
she would come home, we would stock her up on some things and then send her back up. Luckily, she was here
Mhm.
in the state of Florida, but it's important because there's a lot of families that can't even do that. But I
Yeah.
would just say that it is so important that before you reach for that almond joy, before you reach for that Kit Kat, before you
Mhm.
reach for that soda, replace it with water.
Water.
Before you pick up that candy bar, grab a piece of fruit or some nuts. Do something that is different, that when you think about it, it's going to fill you up and it's going to help you study a little bit longer.
Oh,
Okay. Because that
yes. Oh,
sugar
yeah.
rush you get is going to
Yes.
crash at some point,
Really
you know?
fast.
And yeah, and so
Mhm.
that's important. Center for Change also does some phenomenal work with screenings as well. Besides the PSA screenings for men, they do the iFit, that's the colorectal screening kit. I wanted to ask the chances of getting the person to do that and send it off, what's that like? Do they follow through?
We get a lot of
Get them back?
successful.
Oh, good.
Yes, yes,
You
yes.
know, now that we're on that getting back and successful, tell me in the last few moments a success story, if you have one, of someone who came in a certain condition, in a certain mindset, and just working with the members from Center for Change turned it around.
Let me think.
Because I know that there are several stories like that because of how frequent these classes are. You know, there's people who came in there, I'm sure, like, "I don't wanna do this. I really don't wanna do this." And they're looking down and then, you see Peggy, "Come on, come on, come on." They
And
also
she's so motivating. She's so motivating. I'm
Oh,
sure she has a zillion stories,
mhm,
of some that stick out. But I don't know. I really can't think of one in particular. But like you
mhm,
say, I think that just someone who's just a little, apprehensive, or,
yeah,
about just going in and finding out what it's about,
mhm,
and then seeing all of the things that are offered, and just how that just empowers you to go to the doctor, to understand your medications, to understand what questions you need to ask when you go see the doctor,
yeah,
and just the outcome that that will bring, I think, is a
mhm.
success story within itself.
You mentioned that, going to the doctor and asking questions, a lot of times we don't advocate for ourselves because we don't
Mhm.
feel like we know enough. In the last few seconds, you're in a doctor's office every day. Share something that can give a person the permission to advocate for themselves.
This is a very personal thing for me, only because with my dad recently was diagnosed with a heart condition,
Mhm.
and it was like pulling teeth just to get him to go to the
Mhm.
doctor. I think a lot of times there's that fear or the lack of trust,
Mhm.
for the healthcare system and the providers. We think of things like the Tuskegee experiment. A lot of people bring that up, and that has caused them to be fearful about going to the doctor.
Mhm.
But I think that there just has to be a time that you stand up and and be accountable. You
Yeah.
this is your life.
Mhm.
Why
Mhm.
wouldn't you want to ask questions? Why wouldn't you
Yeah.
want to find out what's going on in your body? This is your life, and you only have one. You only have
Yeah.
one. I think, before you go to the doctor, maybe write down questions that you may have, because it is, some people have what they call the white coat syndrome. So as soon as,
Mhm.
they come in, they freeze up, blood pressure
Right.
goes in, so they're
Yeah, yeah.
nervous. And so their mind probably goes blank, so they can't think of anything to ask. And yes, providers are busy. And a lot of people think, oh, they're in and out, they're in and out. But if you ask them questions, they will sit and answer your questions. And if you feel like your provider is not listening to you, guess what? Pick another one. You can go to.
Well, I'm going to tell you what I did, and I wouldn't suggest that everybody do this, but I was uncomfortable with my
Mhm.
endocrinologist, my nurse practitioner,
Mhm.
and I actually left. I actually walked out of the office. So it did not work for me with her, and I will go back only to be seen by the doctor. And you have that right too.
You have that right. You have
Yeah,
that right.
and it's
We
not
we
the
do
fact.
that. We do that. Let's say if we go to a restaurant and we were upset about the service, we say we're not going back to that restaurant. Well, guess why you can't do that about your own health? If
So that's why I said that, Shayla, it was so good speaking with you. Shayla
you
Moore,
too.
MSN, APRN, -C, board certified family nurse practitioner, and on the
Oh,
board for Center for Change. I appreciate you so much.
thank
Listen,
you. Thank you for having me, Miss Monica. Thank
yes.
you.
And family, please help us spread the word. Tap like and click the share button to invite your family, friends, and followers to be a part of our conversation. We're always there for you. Reach back out to Center for Change, and you can do that. One Take Live streams live to Facebook, YouTube, and we're also on Spotify. Until the next time, make it a wonderful day.
Yes.